Hello friends, this is Dr. Mohammed Miraj and today we are going to talk about the topic healthcare providers. Now this is covered under the subject health systems development and the subject is MPH 105, which is first year. So let's begin. Now, as you all know, for the health services to be provided, you require different type of stakeholders, which are known as the health service providers. And you can see from the slide, it is written very clearly that health service provider is any institution or professional. So that means it require or it will include both the institutions. Okay, it can be a hospital, it can be a clinic, it can be any of the centers, as well as the professionals who are either accredited, that means they are basically have the degrees which qualify them to provide the services, or they are licensed to practice healthcare under the existing law. So as you can see in this example, so they have mentioned about the two things, that is the institution or the provider professionals. So suppose there is somebody who is working as a doctor, so the a doctor who is a doctor according to the modern system of medicine, according to the Medical Council of India, anybody who holds the degree of Bachelor of Medicine and Bachelor of Surgery, that is MBBS, and is being registered under the MCI, having a registration number, is qualified to become a doctor and prescribe medicine, and either to do minor operational procedures, okay, as far as the MCI norms are concerned. So such a person can be a health service provider. Similarly, the other examples in terms of institutions could be hospitals, it could be clinics, it could be the rehab centers, it could be it could be a naturopathy center, okay, and the various professionals could be the medical professionals like the doctors, the nursing professionals, there could be medical staff, there could be other allied health professionals including physiotherapists, counselors, psychologists, occupational therapists, okay, speech therapists, etc. So these are the different categories of healthcare professionals who can provide the services. Now, what is a health? Basically, a healthcare plan. Now, a healthcare plan is a mechanism where the people prepare for possible medical needs in the future. Now, you see, we make an estimation that the population of India right now is 140 crores. Now in the coming years, if the aging population is going to increase, now a big chunk of people would be required in order to take care or to give the geriatric services. Okay, so basically one has to way through a scheduled personal contribution, a direct salary deduction has to be there. So you need there is to be a proper mechanism, there has to be a proper system, there has to be a systematic operational plan. So how the things has to be executed, from where you are going to give the professionals, who is going to pay them, what type of services they are going to provide, what is the remuneration for the same. So this will all compose of the medical, dental coverage, as well as the other services coverage of the individual, including the amount and the number of illnesses that should be shouldered by the health agency or the company. So in nutshell, this is the healthcare plan. As far as the healthcare facilities are concerned, these are those areas or tools which are being used to deliver or practice the health services. Now, because what is a healthcare facility? Now, the healthcare facility are combining of two things. One is it could be a wholesome area like, there could be services like the cosmetology services, there could be geriatric services, there could be pediatric services, there could be cardiology services, depending on the area of specialty. The various tools could be, it could be diagnostic in nature, it could be therapeutic in nature. Suppose in physiotherapy, it could be neurophysiotherapy, it could be cardiophysiotherapy. In cardiophysiotherapy, particularly the tools, it can be upon preventive healthcare, okay, preventive cardiology, where a person can work upon the fitness thing. It could be a preventive sports medicine to prevent any type of injuries, and the various tools could be used in terms of in terms of injury prevention. So it is a combination of the whole range of the tools as well as techniques which are being used in order to protect the population at large from illness, as well as to treat them or to cure them. So commonly these can be associated, these type of services can be associated with hospitals, it can be associated with clinics, health centers, and maybe publicly or privately owned. That means who has the ownership. So it can be owned by a trust, where for example there are various religious trusts, as you know. There can be separate entities, okay, like for example like the dialysis. Now the dialysis can be given by a private, by a public, private limited company, even a public limited company in the UK, like the NHS is giving, or in Canada also the government is giving. And there can be also owned by private companies. For example, in India you have a whole range of companies, like nowadays home healthcare is being given, okay, so by Dabur Group, or there are a whole range of other companies which can provide these type of services, and it can be owned by either under registered under the Company Act, that is the private, means the Company Act, or it can be registered under a society or a trust. But the difference between a society and the society trust or the company is, in terms of trust, these are basically not for profit, and companies, and or it can be registered under the Company Act, where it can be for the profit. So likewise, you have got different type of healthcare facilities which can be provided either by the institution or the people themselves. Then okay, so what are the different types? So let us understand about the various types of healthcare facilities. So like I told you, it can be hospital, it can be clinic, okay, it can be given at residence. For example, the home healthcare, like just now I discussed with you the example of, nowadays there are a lot of companies in India which are providing home healthcare. For example, Portia is a big company, okay, it has got more than 400 branches across India. Similarly, there are other companies like Dabur. They are also providing home healthcare at home, a healthcare, and the company's name is Healthcare at Home. Then there are other areas, specialized areas like providing the dialysis services, even the physiotherapy services are being provided at home. So these are the different type of healthcare facilities. Similarly, there are other facilities which might include another type of services, for example, like pharmacy, and there are certain companies which are providing again different range of pharmacy services like 1 mg, okay, where you can get a discount on the drugs, as well as at the same time the drugs can be provided at home, so you get double facility. And similarly, there are other companies where you can get medical equipments at home, okay, so you might get a wheelchair, you might get walker, you might get nebulizer. So you can rent out these because these are quite costly equipments, and on rent you can purchase, you can get these equipments to be used at home for rentals. And then you've got also like other range of services, including the medical labs, from where you can get the blood test and the other type of test. Similarly, you are having diagnostic, organizations, diagnostic procedures, MRI, CT scan, they are also covered under healthcare facilities. And let us understand the various types of hospitals. So you have got teaching hospitals, you have got specialty hospitals, you have got multi-speciality hospitals, you have got super speciality hospitals. And hospital is one where it is one institution where all the major healthcare facilities are being provided, including the preventive healthcare, diagnostic healthcare, curative healthcare, as well as rehabilitative healthcare, okay. So these are and the hospitals are of different types. They can be owned by a trust, they can be owned by private companies. An example of trust hospital is your Dharmshila Cancer Hospital, or for a matter of say Mulchand. And as far as the corporate hospitals, you have got Apollo, you have got Max. These are under big corporate hospitals. Similarly, the hospital could be a super specialty hospital, for example like the GB Pant Hospital in New Delhi, okay, or AIMS, All India Institute of Medical Sciences, or it can be a multi-speciality hospital like the Ram Manohar Lohia, okay, or any other hospitals, for example, like you have got these hospitals, example like the Safdarjung, okay. So these are the different categories of hospitals. Similarly, like I told you, prevention is better than cure, and nowadays preventive healthcare services is one of the main areas, because the area of public health basically deals family medicine, public health. These are the areas where lot of programs have been implemented so that we can keep the health of the public or the population at large healthy, and they are basically helpful in order to reduce not only the cost but also maintain the health of the population generally. So these are big areas to work. Okay, so for this, the health arm department of the government basically release bulletins. They try to create awareness among the public, like how they can avoid and manage any type of illnesses. For example, during the COVID period, we also how the public awareness program, how the government machinery, how the information technology, how the social media was being used in order to create awareness and prevent the disease from spreading at large. Similarly, the hospitals nowadays are emphasizing a lot of impetus upon conducting various seminars to educate the public and in order to promote healthy lifestyles so that the diseases can be kept at bay. So similarly, we have got diagnostic services, where I told you we have got different type of equipments, including the lab services, the blood lab. Similarly, you have got the different type of diagnostic services include the radiological investigations like the X-ray, or the other type of diagnostic services like MRI, CT scan, Doppler. So these are all used to detect different form of illnesses and its veracity. So these are the different type of services that are being seen. Then we have got curative services, and like I told you, we have got different systems of medicine. We have got allopathy, similarly homeopathy is there, Ayurveda services are there. Then you have got Unani, so this comes under the government body called Ayush. Similarly, you have got Siddha. So these are the yoga is also one of the techniques. Similarly, there are other allied health professionals, including physiotherapy or physical therapy, which is popularly called, in order to maintain the service. So as far as the curative services are concerned, the allopathy forms the crux throughout the world, and these are those professionals which perform the most sensitive to simple operations. For example, the operations in terms of procedures, there are procedures, simple procedures like gallbladder removal, like cholecystectomy. Okay, gallbladder removal, it is called as cholecystectomy. Then there are other procedures, complex procedures like cardiothoracic procedures, cardiothoracic like hernia repair. Okay, and then there could be mastectomy, cancer procedures like mastectomy. So these could be various procedures which can be performed by the doctors and the surgeons, and at the same time also the treatment can be given by medicines, where a person can visit the internal medicine expert and the medical management for the complete healing, as well as to take care of the health and prevent the disease to spread and to cure it. So these are the various aspects under the curative part. Similarly, you have got rehabilitative medicine, and under the rehabilitative medicine, once the disease has stuck, then it is very important to prevent the spread, so that the damage is kept under control, and we can basically improve the quality of life. So it is basically all about taking care of the delivery and the restoration of the normal function of the body part. For example, like after stroke, the gait of a person is affected, and the physiotherapist helps to help the person in terms of activities of daily life, that is ADL activities, as well as the gait training. Okay, so that the person is able to walk properly and live a qualitative life and can function well in the society. So these are comes under the rehabilitation. So here you have got physiotherapy, you have got speech therapy, you have got occupational therapy. So these are different types of therapies that are a part of your rehabilitation services, and can be used in the market. So, like I told you, the clinics or the healthcare centers, they are the entry point of patients for the help of the healthcare professionals. And in hospitals, you can see there are OPDs, there are outpatient consultants, there is first aid, there are dental procedures, counseling, psychotherapy, immunization. They can be all performed under these facilities. Similarly, there are other type of services like the dental services, which are run by the private practitioners. Even some of the government also hospitals are also giving it, but majorly the private at large. Okay. And there are, so it all depends on the type of economy and the type of of services they are being provided. In a country like India, we have got mixed type of services. That means the government and the private players both are offering services. Similarly in the US, but then there are more like private players which are playing an important part. And there are also countries like the United Kingdom or the Canada, where majority of the services are being provided by the government, okay, in lieu of the taxes that they earn. So similarly, there are nursing services. In then the nursing services can range from short term to long term for different type of procedures, for including the trauma. And then there are also psychotherapy services. They have got the nursing care, you've got the surgical care. Okay, so these are all comes under the services, under the broad area of nursing. Similarly, like I told you, there are pharmacies, there are medical goods, there are basically entities where licensed pharmacists, including the technology staff and technician, they're providing the services. And the government and the population, they are taking care of these. They take services of these institutions. Like I told you, the medical labs. And then you have got the various plan. Under the healthcare plan, there are two different types of plan, where a government agency, they will enjoin the employees both in the government and the private to pay for their monthly contribution. So that means the government takes a contribution from the person. Okay. And this the contribution that they take will also be, some amount is also added by the government. So there is a co-payment system, and this money can be used for the hospitalization of the person who can avail the services from these organizations. Then there are other organizations like the health maintenance organization, or the HMO. These are all based in US, where there's a type of a health plan where the individual company, employed or the self-employed, they enroll to secure their hospitalization as well as other healthcare expenses. So depending on, like, what type. And then there are these part basically covered under the health financing. So in broad nutshell, if you say, the government can be directly responsible for financing the healthcare. Similarly, the people can avail private health insurance, where they pay the premium, and in time of need they can get themselves hospitalized. And the payment can be made by the third party organization, TPA, or the insurance company on behalf of the patient. Okay, at a price which is being accepted by both the hospital and the insurance company. And similarly, there are other areas where the plan can be basically, can be financed by the government, in terms of reimbursement. That means the patient pays from their own pocket, and then later on the government compensates for this thing. But the major chunk of among all the plan is the payment from the pocket. Okay. So that means the person pays himself or herself for the treatment in terms of cash, by cash. Okay. Or and to the organizations, and avail the services. So this is all for today. Thank you so much. So today we have just discussed regarding the healthcare providers. I hope this lecture will be useful to you, and do watch our channel as well as the other lectures under the Master in Hospital Administration schedule, so that you can get maximum knowledge, and you can score good, as well as it is going to enhance both your knowledge as well as your capacity as a healthcare provider. Thank you.